Hi everybody, I'm Dr. Deed Harrison from Chiropractic BioPhysics Seminars and Technique and Chiropractic BioPhysics Nonprofit, a spine research foundation. What I'd like to do in this video presentation is discuss the cervical Denneroll in terms of the clinical randomized trials that my colleagues and I have performed, showing that this device is capable of improving the cervical lordotic curvature, decreasing forward head posture, and also improving patients' pains, disability, and health outcomes. Now, oftentimes, patients think that they can just lie on a cervical rolled pillow or a cervical towel in their bed or on the floor, and they can get the same results of improving the cervical curvature. While that's a good start, that's really not by itself going to change the cervical curvature. How do I know that? Well, these randomized trials that we're about to go through, we've studied the rolled towel as a placebo intervention as part of some of these trials. And what we find out is that lying on the cervical towel by itself does not change the cervical curvature. Now, that doesn't mean don't lie on a towel rolled up under your neck at night. It's a nice thing to do. It's a start instead of lying on big pillows that put your head forward. Or better yet, get yourself a contoured pillow. For example, Denneroll has a Denneroll cervical pillow that is made for sleeping. However, it has not been found to change the cervical curvature by itself yet either. Really, the best evidence for changing the cervical curve is via in-office methods or this home orthotic, the Denneroll. So what we're going to do is go through some of these trials that have studied the cervical Denneroll so the patient and the doctors out there watching this get an idea of its effectiveness. First and foremost, I need to thank my colleagues, my friends, my research allies overseas at Cairo University in Egypt and from the United Arab Emirates. We've teamed up over the last decade and we've produced several very, very important research trials showing the effectiveness of rehabilitating the cervical curvature. So without Professor Ibrahim Mustafa and Professor Aliyah Diab, these studies would not be possible, so thank you very much for your assistance with these projects and all the time and hours. So does cervical spine correction improve pain, disability, and nervous system function in patient populations using the Denneroll? Now, just to give you an idea of the effectiveness of the cervical Denneroll, we have a video motion x-ray of a patient lying over the Denneroll. And what you'll see when we place the Denneroll peak in the lower cervical spine on the x-ray, it dramatically improves the cervical curvature. So here's the jaw up here, here's the top of the neck and the base of the skull, and you can see the shadow of the Denneroll. And we see very deep extension at the segments that were around the peak of the Denneroll. It also very nicely improves anterior head translation posture when you place the Denneroll low enough. You will not get that same effect on a rolled towel or a pillow. So the Denneroll is key. When you see this type of video evidence, you realize in your mind as a patient, what does it do? Now keep in mind, when you use the Denneroll, you're going to lie on this Denneroll starting at 3 minutes the first few sessions, and then you're going to build up to where you can stay on the Denneroll for 15 to 20 minutes per session. Now most people, it takes 1 to 2 weeks to be able to lie on the Denneroll comfortably in their cervical spine for 15 to 20 minutes. You don't want to rush it too fast because it may create some soreness because your body's not used to the process of having a cervical curvature. So you've got to follow the recommendations that your prescribing healthcare provider has set forth for you. Now, to find a practitioner that is trained in application and prescription of the cervical Denneroll, we're going to direct you to cbppatient.com. cbppatient.com is on the idealspine.com website. Now, if you'll go to this website, what you'll notice is when you do this as a consumer, you are able to find a patient directory as part of the website. Now, cbppatient.com, there's multiple things that are on here as I pull up the website for the patient in terms of what types of information a patient should read or look into when they're looking at corrective care for their cervical spine. The reality of it is, though, what I would like to show you here is simply directing you to how to use this website. So cbppatient.com is where patients can find doctors that are trained in the indications and contraindications for the cervical Denneroll. Now, what the consumer, the public, the patient has to realize is the Denneroll is not something you can just buy on your own and use. It's not a toy. It is an evidence-based prescription orthotic where you have to have an exam and an x-ray to identify, are you a candidate for this device? So chiropractors that are trained in this will prescribe the Denneroll for their patients that actually need this and are indicated candidates for it. So if you're out there, you're a consumer, you want to know where to get the Denneroll, you have to go to your prescription-based orthotic provider. In other words, you have to go to your healthcare provider. Now here, what we can do is we can look up multiple things on what Cbp Technique is, which is the technique that has spearheaded the development for and the concepts for using the Denneroll properly. So you can look at what chiropractic biophysics technique is, but the reality of it is, here's where I want to direct you, is find a CBP trained and Denneroll trained chiropractor in your area. So you just go to this directory, and it's really user friendly. You just type in your state, your city, your zip code, and then you hit the find button and you pull up different providers in the area. For example, I'm sitting here right now in Eagle, Idaho in the United States, and this can be an international directory too. And what I want to do is narrow my scope or my search down to 10 miles. So what I'm going to do is search Eagle, Idaho, and you'll see that there's multiple providers here in Eagle, Idaho, which is really my clinic, myself, Dr. Charlene Harrison, Dr. Joe Betts, who used to be one of my chiropractic partners here at my facility, who now has his own facility, and you can look him up as well. And then multiple individuals, for example, Justin Anderson here, who is an associate doctor at my facility here in Eagle, Idaho. But hopefully what you can do as a consumer is you can easily access Denneroll and CBP trained providers on this website, and just call them up and say, hey, I'm interested to see if the Denneroll is right for my cervical spine. And you'll have to go in and do an examination, spine x-rays of your neck to see if you're a proper candidate for this device. Okay, so that's the Denneroll directory and the CBP doctor directory. Okay, so hopefully you'll find that information valuable for you. And then what we're going to do next is cover 5 separate randomized trials in a very patient-friendly manner to where you can see the effectiveness and the outcomes of patient populations like yourself that has used the Denneroll. Here's our 3rd randomized trial on the cervical Denneroll. We're looking in this particular trial on the effects of normalizing the cervical sagittal spine, that means from the side, for the management of cervicogenic dizziness and related disorders. This is a 1-year randomized controlled trial. This is done by my colleagues, Professor Ibrahim, Professor Aliyah, and myself, Dr. Deed. And you got to realize that we've teamed up over the last several years to do some amazing projects, and this one is one of my favorites. This particular trial is very important for patients out there that are suffering neck pain and disability and dizziness with a cervical spine or neck origin. This was published in the European Journal of Physical and Rehabilitation Medicine 2017, the February edition, volume 53, number 1, pages 57 through 71, and you can access this full text article online for more detailed information. What I'd like to do is just share with doctors out there watching this and also patients out there watching this on the Denneroll is an important part of a rehabilitative care program if you're one of the candidates that fits this. It can rehabilitate your cervical curvature, and it may very well improve your disorder. Okay, now first and foremost, what is cervicogenic dizziness? Well, it's really a condition where the joints in the cervical spine are injured, the ligaments are injured, the muscles are injured, and they're not giving proper sensory feedback into your brain's system for balance and equilibrium and motor control. And people get very, very disturbing altered equilibrium and altered balance from this, and they don't know why. Now, we have to differentiate this as doctors from very serious disorders like, in rare cases, brain tumors, vascular problems in the brain, vascular problems in the cervical spine. And we also have to differentiate this from inner ear problems. In this population that we investigated, we screened people and we ruled those things out. So this is really a population that we've diagnosed with cervical spine origin of dizziness. This condition, when chronic, is persistently associated with disability, psychological distress, and has a pretty high healthcare utilization of monetary resources. The problem is there's no real strong evidence for the effectiveness of most treatments, particularly when we look at long-term outcomes of people suffering from this. Maybe the short-term outcomes, 10 weeks, 3 months, 6 months, maybe they're okay, but when we look past 6 months, the outcomes are kind of meager and kind of bleak for people. They start to suffer again, and there's no real long-term hope. So the reality of it is there's evidence that cervicogenic dizziness is a result of alteration to the information from the sensory nerves in the cervical spine that give input to the system, tell your brain about motor control and output. Okay? What we've identified is maybe one of the key issues in some of the people suffering from this is that they have loss of the cervical curvature. So we looked at a subgroup of people with chronic cervicogenic dizziness, and we took people that had loss of the cervical curve and anterior head translation, and we randomly allocated them into one of two groups. Group 1 got standard physical medicine and PT intervention. Group 2 got that same standard intervention, but then we added the Denneroll to improve the cervical curve. There were 36 subjects in each group. We did 10 weeks of care, reevaluated, and then stopped the in-office interventions, no more care, and then followed the subjects for a year. And what we identified is that people that improved the cervical lordosis by using the Denneroll, they're the ones that had the best long-term outcomes at 1 year follow-up. Shown on this picture is a slide that shows the 3 sizes of the cervical Denneroll. There's a gray device or an adult large, a white device, an adult medium, and then there's a gold device for pediatrics or for patients that just can't tolerate putting their head back into extension. Now, your provider that will prescribe the Denneroll to you is going to size you for the right Denneroll. They're going to fit you for it. They're also going to decide where to place the Denneroll. We're either going to place the Denneroll in the lower cervical spine, the mid cervical spine, or the upper cervical spine. Most subjects get the Denneroll in the lower cervical spine, followed then by the mid cervical spine, and then the least number of subjects get it in the upper cervical spine. The only way to accurately determine where to put and place the Denneroll is using 2 things: postural analysis, a lateral cervical x-ray. That's what's going to tell your trained doctor where to place the Denneroll. Now, the outcomes of this project, I'm going to show you a graph or a chart here, table with all the numbers. Don't get confused by that. I just want to show you that this is right out of the trial. And here's what we're doing. We're looking at anterior head translation, AHT. And this is the experimental group that got the Denneroll. 3.5 means how many centimeters forward initially on the x-ray with their posture. That's 35 millimeters. That's roughly 1.5 inches. Look at the 10-week change in the Denneroll group. That's down to 0.9 centimeters from 3.5 centimeters. That's a very large change. That's just over 1 inch correction in the group that got the Denneroll in their forward head posture. Look at the group that did not get the Denneroll. They went from 3.2 centimeters to 3.3. In other words, standard interventions without the Denneroll did not change the cervical alignment with anterior head translation on the x-ray. Now the 1 year follow-up, look, the Denneroll loses a little bit of the correction. We're at 1.4 centimeters, which roughly we've lost about 5 millimeters of the change. However, it's still much better than what it was when the patient started. Compare that to the PT only and physical medicine only group. They're still 3.5 millimeters forward. In fact, a few millimeters worse than when they started the study. So we know the Denneroll can improve anterior head translation. Also, look at the curve. This ARA, what that means is the amount of cervical curvature on x-ray. Using the 2nd cervical vertebra to the 7th cervical vertebra, it went from 7.5 degrees in the Denneroll group to 21 degrees. That's a 14 degree or near 14 degree change. Look at the PT only and physical medicine group. 7.2 degrees to 6.7. There's really no change in the cervical curve in this group. Only the Denneroll group got a good change. And then at 1 year follow-up, you can see that the results show mostly stable in the Denneroll group at 20.9 degrees, and the PT only physical medicine group is 6.2 degrees. If you don't add the Denneroll to improve the cervical curve, standardized interventions are not going to change the spine. It's because of the forces that the Denneroll applies. It's called extension traction or backwards bending traction. So your Denneroll is known to change the cervical curve and anterior head translation. What did that do to pain and disability? Well, if you look at some of this information here, and I'm not trying to overwhelm you by numerical data, what I want to do is key in on a couple things. The pain and the dizziness. Here, this is a scale out of 10. 7 out of 10 is pretty high. That means the dizziness is pretty bad. It's severe dizziness. Look at the Denneroll group, went from 7 to 3.9, and then 1 year later down to 0.7. That's very important. Now, look at the control group, 7.3 to 4.1. Yes, they did improve at 10 weeks, but look what happens 1 year later when you stop the intervention. That dizziness severity goes back up, 6.2 out of 10. Compare that to 0.7, 0.7. The Denneroll group is way better on the dizziness severity, right? And it's because we've rehabilitated the cervical curve in its alignment. Look at the pain in the neck. 5.7 out of 10, down to 3.7 at 10 weeks, 30 visits, and then 1.2 out of 10 1 year later. That's a huge change in pain intensity at long-term follow-up. And then look at the group that did not get the Denneroll, 5.9 to 3.6. Yes, they are better, but then watch what happens when they stop care. Goes back to 6 out of 10, exactly where they were when they started. Compare that to the Denneroll group, 1.2 out of 10 versus 6 out of 10. There are clear differences favoring the Denneroll group, and that's because we've improved the cervical curve and anterior head translation. And then look at the dizziness handicapped inventory. Now, for a patient out there, what does this mean? This is your overall perceived disability. How badly are you suffering from this condition, taking into consideration things you can't do in your activities? Anybody that's like close to 50 points on the DHI, that's really high. That's moderate to severe disability. The Denneroll group goes from 47.5 to 23, and then drops down to 6.9 at 1 year later. That's a huge change. In fact, that's the best changes at long-term follow-up ever reported in people that are suffering from cervicogenic dizziness. Now look at the group that did not get the Denneroll, 49.8 to 24.2. They're better at the 10-week mark. 30 visits later, but the problem is when they stop the intervention, look what happens. They creep back up, they go back to 39.2. At 1 year follow-up, there's huge differences favoring the Denneroll group, and we're going to believe, or our team believes, that it's because we've rehabilitated the cervical curvature and the alignment, which drives the forces acting on your spine, ligaments, joints, and nerves, and it improves input into your brain. And therefore, your motor controller, your output, should be better coordinated, and you should have less dizziness and less disability. And lo and behold, that's what we found. When we take your x-ray from here, loss of the cervical curvature on this x-ray, and then we restore the amount of cervical curve using the Denneroll, and then we see it's maintained at 1 year follow-up. This is a huge difference. This is what we believe is changing the system. If you're a person out there and you have a loss of the cervical curve on x-ray and anterior head translation, you should consider going to a CBP trained provider, and you should ask them for the Denneroll. Now, there's also things that CBP trained providers do in the office. We do in-office traction, but this is your homework. The Denneroll is like nothing else out there. It is able to restore the cervical curve, and it's verified on clinical trial outcomes, right? Not just somebody's opinion. Look at the changes. And by the way, this is a single case, but the reality of it is this trial looked at multiple subjects with this type of disorder. Okay, so the conclusion of this trial, the addition of the Denneroll to cause cervical extension traction to a multimodal, that means multiple interventions, can positively affect the dizziness management outcomes at long-term follow-up. We speculate this improved dizziness at long-term follow-up is due to the improvement in the cervical curvature and anterior head translation distance. If you're one of these subjects, or you know somebody that suffers from chronic dizziness and neck disability, let's get them to a CBP trained provider, and let's get them using the Denneroll appropriately if they're a candidate for it. Hopefully you enjoyed this brief presentation. Till next time, I'm Dr. Deed Harrison.